Hi, my name is Jonah Mishaan, and I am a licensed psychotherapist and a ketamine-assisted psychotherapy facilitator. And I am making this video today to talk about ketamine-assisted psychotherapy, oftentimes known as KAP, the abbreviation. And I am here to present a more balanced look at this modality, at this medicine, to see more about what it could offer you, if it addresses any of the concerns that you may be dealing with or someone that you know, and to clarify and get into some of the different questions and the misconceptions that are out there. There has been a lot of curiosity about psychedelic assisted psychotherapy at large over the last couple of years and about ketamine assisted psychotherapy. And with that curiosity, there is also skepticism and some misconceptions, some exaggerations, some myths that are out there. So I am here to help you address some of those questions and learning more about the experience. How does it work? How to pursue working with a therapist, making sure that you're going about it safely? What are some of the side effects? What are some of the risks? And any related questions that can help to answer and provide more insight about working in this way with this modality. So what is ketamine-assisted psychotherapy? What is the psychotherapy piece? You may have heard of ketamine clinics, and these ketamine clinics have a different approach. The psychotherapy component isn't really part of the treatment model. So someone comes in, they get an infusion, it's usually IV. Sometimes it's IM, which is intramuscular, and they get an infusion or an injection of ketamine, and they have their experience, and they leave and they go home, and they go about their lives. And there are positive effects. Certainly there's research that shows that there are these really durable effects of this modality, this format. But it doesn't have more of that deeper engagement, awareness, processing that occurs through working with a therapist. Part of that process is being able to go inward. It's not just taking ketamine, hoping for the best, but it's working with a clinician that is there to help act as a guide, to hold space for you to have your experience, to connect with those different parts of yourself, and to see when and if you are getting stuck, how to help to move forward, how to not get caught in certain negative cycles, certain thought loops, the negative emotions and judgments that you might have about yourself. So this approach helps to really deepen one's internal orientation. It helps to process and work through different traumatic experiences, memories, and it provides more of that insight and really a way of being moving forward with yourself and with some of the problems and conflicts which you are bringing into the therapy space. What are the benefits of KAP? There are a number of different positive outcomes or different things that KAP can provide. And there are people that choose to utilize KAP for emotional reasons, for relational patterns or difficulties that they're having. There are the neurological benefits, there are even physical benefits which some people obtain through their experience. KAP can bring really rapid relief from depression or anxiety. It can help to loosen these negative, rigid thought patterns, so the ruminations and the loops that one might get in. Some people feel like they are able to access certain memories and certain experiences, certain emotional states that feel like they've been walled off. So joy, grief, compassion, oftentimes creative energies are able to emerge as a result of getting through some of these blockages and some of the obstacles that have been there. As mentioned, ketamine promotes neuroplasticity, so your brain is able to make new connections, able to learn different things, different ways of being, different ways of relating to oneself, and developing new habits, better coping mechanisms. And there are these ways that ketamine is able to help certain patients that feel really stuck in therapy. At times, even if you're working with a good, supportive, talented therapist, there may be ways where you feel like you are hitting a wall. And so ketamine and psychedelic-assisted psychotherapy can be one way of providing a boost. So it's not like it pushes you over the wall, but it can give you more of that vision that actually I can see what's on the other side of it, and the resolve and the strength to take that step over it and get past a lot of what felt like these obstacles that were limiting, that felt maybe even in some ways insurmountable. There are oftentimes ways that people feel this larger sense of empathy, more understanding towards people in their lives, more understanding towards themselves, The self-compassion that people have leaving a ketamine session is oftentimes one of the most powerful and profound outcomes and benefits of it. It is important to say that not everyone gets these benefits, that you may get some of these, you may get none of them. So just being aware that everyone's experience is different, there is no guarantee, and that also, besides for individual differences, there are differences in each journey. So you may have had one journey that went one way and it was really positive and you got so much out of it, and the next one you felt like you were getting stuck and it maybe was more challenging in certain ways. Then you came back and did another one and you were able to get more clarity and maybe work through some of the material that came up on that previous one. So just keeping that in mind, that there is no set script for how this proceeds, and being aware that ultimately your experience is going to be unique. I want to talk about some of the myths and misconceptions about KAP, because as mentioned, there is a lot out there, and oftentimes these stories, these reports are a bit sensationalized and presenting things from a certain angle. So here are a couple of the myths that are out there, some of the exaggerations about KAP. One of them is that ketamine is just a party drug. And despite the fact that there are ways that ketamine abuse is a concern, there are people that use it recreationally, that use it irresponsibly, ways that people do get addicted. There are these positive uses and effects of it. As mentioned, even besides for using it in mental health, using it therapeutically, ketamine is still used as an anesthetic. Oftentimes in dentistry, it is used by vets oftentimes. Another myth is, and a way of referring to it, is a horse tranquilizer. You may have heard of that one. And that is because it is used in veterinary practices. So it may be used for horses. It's used for quite a lot of animals, and including humans, for the anesthetic purposes. But most significantly is that there is all of this research that shows about how effective it could be for mental health conditions. There also is the conception that you just go in and take ketamine and that's going to fix everything. And that also is not really doing justice to how complicated the process is. It's not just you go and take a drug and that is what heals you and fixes things, but it's the commitment to working with a therapist, or really going into some of those uncomfortable areas to be taking part in a structured therapeutic process that, in addition to the substance, are what creates the most durable, long-lasting, and powerful changes. One other misconception is that you lose all control, that you are totally unconscious, and that is not true. The way that we use ketamine in a psychotherapeutic context, it's not as high of a dosage as that which is used in anesthesia. So for the amount that we use, it produces a dissociative state, which means that you are not feeling the typical thoughts, emotions with the same kind of intensity. So there is this this bubble, is one way that I've heard it described, that you feel that you are encased in. And so you're able to go and look at some of those difficult, painful, traumatic experiences without that same level of activation and arousal that was there previously. It allows one to step out and look at things from a different perspective without the same intensity, which may prevent really moving forward and looking at things from a different view. There are ways that people might believe, or things people say about ketamine being unsafe, untested, that maybe you will take too much and die from it. And while there have been some deaths related to ketamine, the deaths that are out there are really not from the drug itself. It's from, most oftentimes, people losing consciousness, usually in a pool and drowning, or it may be some underlying cardiac issues that are there, which is why we do the medical screening. But there are hundreds, literally, of studies that have examined and verified how effective ketamine is for a variety of mental health conditions. The last myth that I wanted to touch on is that it's for people who are looking for a quick shortcut, and it's not about doing the work, it's about just a quick fix. And that really is not the case. Again, I mentioned before about how difficult some of these experiences can be, and that besides for the actual journey itself, so much of the work is the following integration and making changes and being able to learn from the experience about how to be differently, how to relate to yourself, to others, to the world in these different ways, so that you are moving forward using this as part of a larger healing process, which is not limited to going and taking the substance and just leaving it at that, or going and needing to have another ketamine experience in order to maintain any of the gains. Who is KAP for? It does work for many different conditions, but it's not necessarily for everyone. So someone who is struggling with treatment-resistant depression, persistent low mood, dysthymia, there is the most and strongest body of research to show that it is effective for anyone under that umbrella. There is the research that shows for anxiety, PTSD, OCD, that KAP is very effective. And someone who might be dealing with certain existential questions that are coming about from a loss, from death, from maybe a physical condition, major life transition, that KAP is quite effective for. And if there are these patterns that you feel really stuck in, these entrenched ways of being, that KAP can help loosen that rigidity and a lot of those cycles that one might find themselves in. Some of the conditions or clients that KAP would not be as suitable for, pregnant women, or if you're breastfeeding, there are more of the concerns and medical issues that come about with that. If you have a history of psychosis or mania, a severe personality disorder, KAP is not advised. It's contraindicated because of the ways that it could produce an altered state of consciousness. Oftentimes it can shift and derail what might for some people be a more fragile sense of self, sense of reality, and so it's not suitable if anyone has that sort of history. One thing that's important to note, well, before, actually I should say that some of the medical conditions are high blood pressure and cardiac issues. There are concerns about that. As mentioned, part of the process that I utilize there is a medical screening, so they will ask more of those questions about your medical history to make that determination if there is anything contraindicated. And the one that I want to highlight, which is a little bit of an intermediate stage, is for substance abuse addiction. Now, there are concerns because there are people that take ketamine and abuse it. And that is a reality that's important to note, that ketamine is becoming increasingly popular as a drug of abuse. And so there are concerns with someone that has an addiction history that ketamine can be a concern of fostering any sort of dependence. However, there is research that ketamine actually can be effective with addiction. Part of that being the way that ketamine can help to open up a lot of those negative entrenched patterns and those loops that one can get into, which addiction certainly qualifies as. When somebody is compulsively using and feeling stuck and doing something that they don't want to do, there is research that shows that ketamine can be effective for that. So it's just something to note and to be aware of. That probably requires a little bit more extra attention for you as a clinician to make the determination if that is going to be safe and effective for the particular person that you are working with. I decided to bring KAP into my practice because I have seen people that have been trying so hard. They've been in therapy for years. They've been working on themselves in many different ways. And there are ways that despite that, they still feel so stuck. And having seen ways that this can shift things, oftentimes so dramatically, it's something that I felt called to. It felt like something that was really important to offer. Of course, noting that it's not like some sort of Band-Aid. It's not something that is so easy. In fact, oftentimes a lot of the growth and a lot of the healing comes through working through some really intense, painful, scary emotions and experiences. But having seen ways that it can help people, it is something that I have decided to pursue, and I've been able to see and witness and be a part of some really amazing and profound changes. So it's another option, it's another tool in the toolkit. I don't believe that it is something that replaces psychotherapy, but oftentimes there are ways that it is able to enhance and work together with the therapy. Both of them synergistically are able to do so much more. And so it is something that is a consideration if you fall under any of those categories, any of those conditions that might benefit, to see if that is something that can offer more of those benefits to you. The work doesn't end after the dosing session, actually. In many people's minds, the next stage is just as, if not in certain ways, more important, and that is the integration stage. So following the session, we will schedule another meeting, a therapy session, 24 hours to 72 hours after the dosing day. And during this time, we are focusing on how you can take from this experience insights, different ways of being, the clarity, the changes that feel important, how you can implement those into your life. And the reason why this is so critical is that we obviously are not going to be taking ketamine or any psychedelics all the time. And so the benefit of this experience is that it gives us a different way of being moving forward. So the question is, how am I going to be different leaving this? What am I going to do to implement these shifts? And how can I identify when I get stuck in some of my patterns? How can I start to notice when those show up? It's a continuation of the meaning-making process and being able to weave these different strands together into a more coherent narrative for who you are, for how you are, and how you can be moving forward. There are different actions, different things that people find really helpful for the integration stage. For some people, it's journaling, it's writing and sharing more about their emotions, their thoughts, some of the things that are coming up in the immediate aftermath, some reflecting on the experience itself. It's a time where you might be feeling a little bit more tender, and so going easy on yourself. People really benefit and enjoy being in nature. Physical exercise and activity can be really valuable, and having more of that quiet time to help to process one's experience before getting back into a regular routine. It can be helpful to talk to a friend, a family member, a partner, someone that you really can trust, but it's very critical that it be somebody who is able to listen, to support, and oftentimes even well-intentioned people that are close to us may not be as suitable for helping in this regard to work through what might feel like a very big experience. This stage is a very critical window. Earlier, I was talking about neuroplasticity. And so there is this critical window that occurs after the dosing session where the input, what you are feeding yourself and your brain, can have really substantial effects. So you are in more of that pliable, flexible, open stage, and there is more of the opportunity to start to make certain changes that can really be concretized and internalized on a much more profound and powerful way. So with this, KAP can be a real catalyst, not just for a temporary relieving of symptoms, but for something that can create really sustained, ongoing, meaningful change. Something that is also important to note is that there is the musical playlist, which really is an essential, very valuable part of the experience. Some people might find that somewhat surprising. It's just music, could be anything, but really the music has a very strong presence in the room. So I have put quite a bit of time curating, developing a playlist that is meant to induce and enhance expansive states, and that allows you to move through different emotional processes. And something that they say is that the music is like the other therapist in the room. So that is something that during the experience is really helpful to just fall back to the music, to what is going on somatically in your body. And my role there, I will talk more about how I am able to guide and to help you navigate through some of what might come up specifically on your journey. So in terms of the history, although you may have started hearing about ketamine a lot more over the last couple of years, it's actually been around for a long time. It was developed in the 1970s, and it was and still is used oftentimes as an anesthetic. In higher doses, it produces the anesthetic effect. And what doctors, surgeons were finding out was that there were some unexpected side effects of the ketamine that they were facilitating for anesthesia purposes, that they found that over the next couple of weeks, their patients were less depressed, that they noticed these marked improvements in their mood, and they began to discover and do more research in ketamine and finding that actually it lowers depression, emotional arousal, suicidal thoughts, and it does this rather quickly. So if you're comparing it to SSRIs, which is the standard psychopharmacological treatment for depression, ketamine works way quicker. SSRIs take 4 to 6 weeks to take effect. And for somebody who is really struggling, 4 to 6 weeks, even 4 to 6 days can feel like a lifetime when someone is suffering and hurting that badly. So for that reason, ketamine is really a great alternative, and it also does not have the same side effects that people often get from SSRIs. So that becomes an obstacle in treatment that for some people, the SSRIs just don't work. For some people, they do work, but they have all these side effects that can even, for some people, feel worse than the depressed mood or whatever they might be struggling with. So the treatment ends up being more severe than the actual condition that it's addressing. Ketamine is useful in that regard that it doesn't have the same extensive side effects. And in terms of more about the way that it works, ketamine targets the NMDA receptor in the brain. This receptor is responsible for the release of glutamate. Glutamate is a neurotransmitter, and that is responsible for a lot of our motor movement. And so one theory behind it is that by lowering the glutamate in a given area of the brain, that it actually raises the glutamate produced in other areas, and it leads to more of this pervasive sense of well-being and mood improvement. When it comes to the day of the session or the dosing day, you'll arrive at the office, the lighting is set up, we use soft lighting. The seating is comfortable. That's a really important part of the process, making sure that you are physically at ease and comfortable. And as mentioned, the music playlist has been developed and curated. We'll get started by revisiting your intentions, briefly going into where you're at, what feelings are coming up, what you might be struggling with, or what you're bringing into the actual session with you. And once you take the ketamine, the way that I work, the method of administration is lozenges, sublingual lozenges. So you take the lozenge and you swish it, it dissolves in your mouth. After a couple of minutes, you spit it out. And then usually as you're swishing, you start to feel the effects, and you will lay down on the couch. There is an eye shade, you put on an eye mask, and you go inward. And really for the next 60 to 75 minutes, it's an inner journey and experience. And you may experience different things during that time. So some people might see vivid imagery or memories. Some people might have, might feel a sense of lightness, feel a sense of connection, may feel compassion for themselves or for others in their lives. Occasionally, there may be challenging emotions that come up. Maybe it's anxiety or a difficult memory, maybe some trauma that's activated. And that's where me being there, I'm able to help to provide more of that sense of safety, security, to work through whatever might be coming up. And so there is this way that the ketamine experience is really an inner directed one. So the therapist is not there instructing, being as structured and getting involved as directly, but is there to provide a safe container and support for certain times where you may be struggling. One thing that is really important with regards to KAP and any psychedelic assisted psychotherapy work is that therapeutic touch is oftentimes a very helpful component. So that's something that we discussed beforehand, where you're at with regards to therapeutic touch. There are some people that are like, I'm not comfortable with that, I don't want that. And there are others that feel like they're good with that can help them. So that is also something that before a clinician should ask and check in, even if you have given consent previously, to see if you are still there and if that aligns with where you're at. So there are those ways that my role is really to hold the space for you, to allow for more of that inward journey and depth of experience. And then as the effects of the medicine subside, there is a reacclimating period, getting back to baseline, and there is quiet time for reflection, and there is a processing that occurs afterwards, which is kind of like a therapy session unto itself, talking about what came up for you, helping to weave together some of the different strands, some things which might feel like a lot, might feel confusing, although oftentimes people feel a very deep sense of clarity. They feel a sense of lightness, feel like they've shed something really heavy. So it can be just a wonderful time to relax, to connect, to enjoy processing and sharing oneself and one's experience. An important stage of the ketamine-assisted psychotherapy, the KAP process, is the preparation. Working with a clinician, you have more of the engagement with what you want to get out of the experience. So there's more of this preparation that's occurring before. You're not going in and taking a substance and seeing wherever it goes, but there is that prep work. And so there's the momentum that's already built. So it really is like the experience is starting beforehand. So once you take the medicine, there is already the foundation that you've laid. And so you're able to get to certain places quicker. There is the intention setting process. So you are working with a therapist and clarifying where it is that you're getting stuck. What are the conflicts? What are some of these patterns that have shown up in your history? What is coming up for you presently? And where do you want to be? What is that vision of what your life looks like, of how you can get past this struggle that has been really bringing you down, limiting you? So there is also the screening process that is an essential part of the prep. And I work with a platform, an organization that handles the medical screening. So you will be meeting with a doctor who is able to assess if you have any conditions that are contraindicated, able to handle any of the health-related concerns or questions, and they prescribe the actual ketamine. And so going back to my role, the role of the therapist, there is also being able to identify and explain more about the experience, what to expect. And one thing that is really essential is that I mentioned the intention setting process. And there is this fine line, or this duality, that there is setting an intention and being clear and bringing to the experience more of what you want to get out of it. And there is also not clinging on to any set expectation of how it's going to go. When it comes to KAP, when it comes to any psychedelic assisted experience, we don't know exactly what it's going to bring up. And what you might see, what you might experience, any memories that might be brought to the surface, any physical experiences that you might have, clinging to a set idea of how it's supposed to go and what you're supposed to get, that can actually be a way of getting stuck in the experience and not being open to the mystery of what it holds, which is something that can be a really powerful, profound part of this experience. Ketamine-assisted psychotherapy is not a cure-all, it's not a magical elixir, but it is something that can be a doorway to hope, to freedom, to a really profound sense of well-being and accepting of oneself and one's situation, and for really deeper understanding and insight. So if anything about what I've shared with you resonates, you can reach out to me. You can go on my website, mishaanpsychotherapy.com, and you can schedule a consultation, and I'd be happy to talk with you to see if we are the right fit and to make the determination in whatever context psychotherapy or working together with KAP is going to be a good option for you. Thank you for watching this video and for taking the time to listen to me and to learn more about KAP, about some of the possibilities which this modality offers, about some of the positives, some of the negatives, some of the concerns, some of the myths, and some of the reasons to be really excited and looking at this as a substance and an approach which really can offer help to a lot of people who may be struggling, may have tried a number of different approaches that haven't worked. Thank you, and I hope to hear from you if you do feel like we would be a good match of working together.